at present I am going to discuss with you about surrogacy treatment. What kind of patients has to go for surrogacy? Who has to go for surrogacy? How to select the treatment of surrogacy? There are so many doubts for the patients. So, surrogacy is a kind of treatment. It is not the other people's baby, it is your own baby. The surrogate mother is totally different. Her genetic material we never use for anything, and we will take egg donor also separately, the separate egg donor. Otherwise, if the couple is having egg, then the egg of the mother, original genetic mother, and sperm of the father. If there is any gamete to be taken for donation, and we will explain each and everything to you, like the profile of the egg donor or profile of the sperm donor. Usually egg donor only we will take, and ICSI, ICSI and blastocyst treatment we will do in surrogacy procedure. Who has to go for surrogacy treatment? Suppose if IVF is failed for 4 times or 3 times or 4 times or 5 times, people go on doing IVF procedure, it is waste. Maybe IVF, maybe ICSI and blastocyst. So usually the endometrium receiving will not be proper in few of patients. So wherever the endometrium is very thin, wherever the endometrial cavity is not good, wherever the endometrial cavity is studded with the pelvic inflammatory disease or TB endometritis, or if there is any adenomyotic uterus, that is bulky uterus. So bulky uterus cannot bear the baby more than 2 to 3 months. So in that adenomyosis, actually myometrial problem will be there. Suppose if there is any septal resection, we have sometimes many patients will have the septum in between the uterus. So from the fundus, actually the septum will be occupied at least half the place or sometimes full place. We will resect the septum. After septal resection, if the IVF procedure is not successful, we have to go for surrogacy. And suppose if there is any endometriosis, or if the pelvis is frozen, that is totally studded pelvis, like all the adhesions in between the uterus, ovaries, tubes and the surrounding material, ligaments and all, then we cannot utilize that uterus to bear the baby. So that kind of uterus, grade 3, grade 4 endometriosis, suppose if it is grade 1, grade 2 endometriosis, we have to go immediately for the better option, that is ICSI treatment or ICSI and blastocyst treatment. Suppose if 2 or 3 times, if it is a failure, then immediately you go for surrogacy. Suppose if the myometrium is studded with small fibroids, that is multiple fibroids, so then also many people will try for ICSI or IVF. But 2-3 times if it is a failure, then immediately you have to go for surrogacy treatment. And in many other conditions, sometimes maybe no uterus, absent uterus, maybe the uterus is very small and very thin endometrium that time, and usually this surrogacy procedure, you can opt a non-commercial surrogacy or a commercial surrogacy. Now I am going to tell you what is non-commercial surrogacy. Suppose your own sister, she is ready for bearing your baby, your own baby, and she is just giving her womb for rent, and she is not having any genetic connection with the baby. And so your own sister or your own friend, your own relative or known people, very much known people, and that expenses and all medication should be bear by yourself. And after that you can keep the mother with you, or you can keep the mother with your mother or somebody else, or she can be at her home only. So whatever it is, and if she is very good, if they are very capable of doing things, like if they are able to, like few people know what will happen in many people, like they feel as if they are bearing their own baby, they will act, and afterwards again they will tell something, no, that baby has expired, that is the reason actually there is no baby, like that they will tell. These people are a bit commercial and they'll take money from you. And your own sister means, like they will tell everyone that they are bearing your baby and it is surrogacy baby, no problem for that. So the people, known people who are bearing the baby, that is acting as surrogate mother, they should be kind enough, they should be generous, they should be they should not be scared for the society. These are the people. And the mother should be in between the age of 20 to 30 years. So you have to select such kind of surrogate mother from your family side. And if it is non-commercial surrogate mothers will come for the money sake only. You have to give money for them. You have to give, if you are opting for egg donor, the egg donor should be separate. The egg donor will not be the surrogate mother. So you have to pay money for surrogate mother, you have to pay money for egg donor, you have to pay everything for the procedure. So depending upon that, actually the result will be within 1 month, or it may take 2 months, or it may take 3 months. So you have to wait patiently. It will not be once for all. Within one cycle, everybody will not conceive. But many people, 50%, 60% will get conception. But the remaining 40%, they may take second month, they may take third month. So you have to give the option, you have to go very legally. And so whatever legal points you want, you have to undergo legal documentation, then you have to take them for surrogacy. Even though that is non-commercial, or even though it is commercial, we even go for legal agreement. But you have to take care of the non-commercial surrogate mothers very well. You have to take care. And commercial surrogate mother, the caring will be maybe by agents, some of the people, or maybe by doctors, or whatever it is, whatever option you select. Whenever there is a urge for your own child, whenever you are not going to go for adoption, because even though nowadays adoption, many people, they are not willing for adoption, because even 45 years, suppose if the mother is 45, father is more than 50 years, actually people are not giving for adoption small babies. The one thing actually which is very useful in case of surrogacy is, from the day when your child is there with you, at least one genetic material will be there with your child, your genetic material, so that you will be very happy with the surrogacy procedure. And sometimes adoption, actually it is taking, for a few of my patients I will give a letter that they will not conceive and they can go for adoption, I will give letters for them. It takes 2 to 3 years, and you have to go for courts 3-4 times, and you have to go for the police department, and you have to face some of the enquiries, how you people are together, how much money you are having, whether you are having any bad habits or not. There are so many enquiries for adoption also. So that is the reason actually many people, they are coming, they are opting surrogacy only. So whenever you want to go for surrogacy, you talk to your doctor very properly, you inquire each and everything, and you go for surrogacy and get your baby successfully. Up to 99% chances will be there with surrogacy treatment for having your baby.